elsewhere on the continent. So my task is a simple one, to thank everybody for their efforts so far. Really the teams from BCG and from Villgro, from JICA, and yourselves as the cohort, the second cohort. A brief word of congratulations for getting to this point. It's been a pleasure being associated with you, and hope to see you go from strength to strength. Okay, just a bit of background now as to how the accelerator started. So I think we all remember what life was like back in 2020 when the COVID pandemic hit us. And as part of that shock, we as the development agency, AUDA, took it upon ourselves to try to find African solutions to some of the issues that we were being faced with on the continent in terms of responding to the pandemic. And we were very fortunate to have our partners, JICA, who supported us in this initiative and have walked with us through this journey, as well as BCG and later Villgro. So I think what the COVID pandemic meant for us is it really highlighted our dependency as a continent on external supply chains, and stressed the fact that this dependency made us less resilient to external shocks, and that we needed to find homegrown solutions within Africa to try to build our resilience to COVID and additional shocks that we may be faced with in the future. So around mid-2020, we embarked on this wondrous journey that we've been on, and started to design a program that looked to support solutions coming from Africa to scale and to grow and to eventually help to increase Africa's resilience. So later on in 2020, as I mentioned, with the support from JICA and the technical support from BCG, we launched the Homegrown Solutions Accelerator to look at supporting African entrepreneurs to strengthen the continent's pandemic resilience. Now, since then, we've been through one cohort of companies, and this last cohort will be the final session. We'll be presenting to you later in this session, and really it's been a fantastic effort by everybody concerned to really look at the lasting impacts and really tangible solutions towards strengthening our healthcare systems on the continent. And we hope to continue this further as time goes on in coming years. A little bit about the companies that we looked at. So through the design phase, we had a very close look at where our comparative advantage was and what was needed in terms of the gaps. So we're very proud to say that we are the only large-scale health-specific accelerator in Africa at this stage. And we not only focus on growth, but also mature stage companies within this acceleration offering. We have, I won't go into detail there, but you can see there's a number of criteria that we use to select the companies. And this continues to be provide very strong guidance in terms of selection and our ability to provide the dedicated support that is needed to really boost our continent in terms of the healthcare sector. Next slide, please. So in terms of what we offer, as you can see, there are three main offerings. And each individual company that is participating in the cohort receives support according to a tailored acceleration plan. This is divided into three main offerings. The first is context-specific advisory, looking more detailed in terms of the business model, validation and advisory services to align it in terms of the vision of the company and where they're wanting to go. And each company is assigned a specific consultant to assist with this, this acceleration tailoring process. And as I've mentioned, we have a team of world-class consultants to help with this process, with BCG and Villgro, who've really provided an able and willing assistance on this. The second area of offering is investment readiness support, where we try to help to match the needs of the companies to specific funding opportunities, prepare reach outs and coaching, and also support materials. And this is really to help to broker introductions to potential investors and funders. The third area is in terms of matching to strategic partners, to really help to unlock the ability to scale companies and to look at aspects of opening up trade and regulatory landscapes. And this is becoming more and more relevant within the African Continental Free Trade Area discussions that are happening. And here we broker introductions to potential partners and across both public and private sector and social sectors. So here we try to leverage from our existing joint networks and introduce the companies to leading organizations that will help to grow businesses and to scale not only through financing, but through partnership and advice. Next slide, please. Okay, so here we are in terms of our footprint on the continent so far. In 2022, we scaled significantly from a total of 5 companies that were in the first cohort to 14, what we saw as outstanding homegrown solutions. So we went through a very intensive process of receiving 160 applications, and these were further shortlisted to 28, and once more refined down to a cohort of 14. And you can see the representation across the continent. We have companies from all areas of the continent, and it's heartening to see that there are so many opportunities within Africa to support wonderful ideas and initiatives that are coming from the continent, and we look forward to expanding on this even further as years go by. So what you will hear about in the next session is I think it's 2 or 3 additional companies who will provide their interventions and give you a little bit more of an idea of where they are going and what they have achieved and what they need for the future. So I think that's it, Ilahe. Without further ado,
thank you so much.
Move on. Thank you.
Perfect. Thank you so much, Bernice. And with that great introduction and very helpful context, let me call upon our first speaker, Dr. Dawa Odulana from Doctoora. Dr. Dawa, over to you.
Thank you very much, Eli. Happy to be here, and I guess I'll just proceed with my presentation. Should I go ahead to share my screen or?
Yes, please do.
Okay.
And if there are any issues, technical issues, we can share from our side as well. But we can see your slides, so I think this is perfect.
Good. We're good to go. Can you see my slides?
Yes, we can.
You hear me clearly?
Yes, can hear you, can see you. So all good to go. Thank you.
Just 1 minute, please. Good. Good day. I'm Dawa Odulana. I'm the founder, CEO at Doctoora. So I'll just start with a bit of introduction about myself. I'm a medical doctor. I'm also a management consultant in healthcare. Prior to starting Doctoora, I spent 7 years working in Nigerian healthcare space, both at the government level and the private sector. I worked in both urban and rural facilities across the country. Before that, I worked with Johnson & Johnson, mostly in market access for orthopedic products. I spent a very great deal of my medical education, I think most of it, in UAE, and they had such a great healthcare system. It was such a shock to me when I moved back to Africa, and Nigeria in particular. And I also did some visiting to Kenya, and the health systems here were really poor. If you really look at it, we're suffering from a shortage of healthcare workers. We're ranked very low in health systems ranking. Nigeria in particular is 163 out of 191 healthcare systems. And this is really poor for a population of over 200 million people. Now, the real problem here in Africa and Nigeria in particular is that quality healthcare is out of reach of those people who really need it. And is out of reach in two main ways. It's either too far away, they have to travel a long distance to get there, or it's too expensive for them. Now, what we've seen is that the best hospitals are located in the urban areas, while most of the population, over 80%, for example, in Nigeria, live in the suburban and rural areas. And so there's already a mismatch. This generally causes people to delay healthcare services until they are very sick. And when they delay healthcare services like that, they don't come for preventative visits, and they don't really, purchase a lot of healthcare services throughout the year. This compounds treatment costs in the future. Now, the real impact right now is that the healthcare providers have a lot of free space in their facilities, and then they're not making that much money. Most of them are threatened to shut down. There's a great opportunity because the lower middle class and the lower class who are struggling to avoid poverty are caught in the mix here. They need to figure out a way to get healthcare services at affordable rates. And that's where we come in as Doctoora. Sorry, I just had to quickly turn on cool it. So at Doctoora, what we're doing is we're trying to provide affordable healthcare for a vast majority of Nigerians who do not live in the urban areas, mostly work in the informal sector. And, mostly the informal sector, because those workers in the formal sector have health insurance provided by their employers. Those who are in the informal sector have absolutely no options and have to pay out of pocket. And that's over 97% of the population. Now, when we look at what we're doing, what we're essentially creating is a network of community hospitals for middle to low income families in suburban communities in Nigeria. We partner with existing facilities by renting their physical space, because as I said earlier, because of low uptake, those people have a lot of free spaces. So we rent that space, we combine this with telemedicine and our team of roaming doctors to deliver healthcare services at the different communities. This way we keep our working capital low. The hospital owners can maximize return on the investment for their infrastructure. And then we increase income for doctors and make it easier for patients to get healthcare in their community. Our product is very simple and accessible via web, mobile, and USSD. We've built quite a lot of technology, including our own electronic medical record system. We have diagnostics and specialist search. We provide medication through an e-pharmacy. And we have portals for employers to add their staff and provide healthcare for them. We've also developed a lot of other products along the wellness and nutrition line, which we intend to launch as we gather more customers. Our approach is quite simple. We focus on digital care coordination, which is really designing care pathways and protocols for doctors to be able to execute regardless of location. So our doctors are able to move from location to location. So we also make it easy for them to, plug and play regardless of where they are. We partner with existing facilities. Our model of partnership is mostly to rent their facilities for use. Some of this might involve investing in infrastructure to upgrade those facilities. And the last component, which is very critical, is the payments component. So we have a prepayment system that allows users to pool funds together as communities to buy healthcare from us. So this gives advantage over other insurance schemes because with our system, users can roll over whatever health prepayments that they haven't consumed during the period. So a bit more about how we do things. We pool funds, we pool the services together, and we categorize our services and providers along three core areas: preventative care, acute care, secondary care. So users are able to get a full range of care from Doctoora, essentially from diagnostics to pharmacy, preventative, acute, and secondary care services. We have a very strong partner base in terms of health professionals across 18 states in Nigeria, a total of 1,127 professionals in total, mostly specialists, mostly in the peri-urban areas as well. The market is ripe, and we believe that if we can capture these young people who are being forced into informal sector jobs due to a lack of employment opportunities in the formal sector, we can, be their healthcare providers for life. These areas are really booming economies: transport, construction, and even the petty trade, where we are able to really partner with market unions and communities. Our model is simple in terms of revenue acquisition. All users have to pay $4 membership to access our platform, and then we charge 25% margin on every transaction they perform within the platform. With regards to the prepayments, we've created e-vouchers at $8, $16, and $32 to make it easy for people to purchase. We've targeted, in our first few years of operations from 2018 to 2021, our business was mostly targeted at the upper end, upper class customers who were able to pay larger amounts for services. And we were quick to realize that that market was too small for the sort of growth we wanted as a company. This prompted us to actually start focusing on the lower class and the lower middle class areas where there are vast numbers, there's a lot of volumes. The margins are a bit lower. And since we launched this product targeting them, we've been able to get 1,480 new customers. Most of these customers are in the semi-rural areas and the suburban areas where we really want to focus, and this has really helped. The majority of them have come from the employers, so we've been targeting employers, especially bar owners, restaurant owners, who would not typically buy insurance. But with this platform that allows them to, prepay for their employees and retain those credits for as long as the employees are with them, and switch to other employees when needed, I think that they've been able to believe in this product better. We believe there's a lot more in the market to acquire, and we've just been able to project what our gross income would look like at 50,000 users. And, you know, by 500,000 users, we're probably looking at over 70 million in annual gross income. Our route to market is quite simple. We're going for bulk acquisition of users. We target businesses so that the employers can onboard their employees. Like I said, these bars typically have 100 to 120 staff each. We target market unions. We've recently signed a deal with the largest market union in the largest market in West Africa, in Lagos, Alaba International, to get 10,000 users on board from their 5,000 businesses. We've also started working towards cooperatives. Those ones typically have 1,000 to 2,000 users, and they are also based in the markets and function similar to market unions. After this, we would explore direct retail, which would involve building our agent network. The competition is quite vast. One of us, and a very good colleague of mine, is here on the call as well. Most people provide very expensive care. Dr. Express and Ardrolad are quite close to us in terms of the affordability, but in terms of the integration of care and the range of services that users can get, we stand out. We also stand out in terms of quality and customer satisfaction when you compare us to the regular health insurance or HMO companies. We have a very strong team with over 30 years experience in the healthcare space. Like I said, I have over 12 years experience now managing healthcare services, working on market access for the likes of Johnson & Johnson, have an MBA in healthcare from Imperial College Business School. My colleague, Dr. Bola Joko, is a dental surgeon and a management consultant as well, who has led multiple dental clinics. And we have a very strong chief technology officer, Mr. Ayo, who has worked for the likes of InterSwitch and has been instrumental in bringing all that knowledge into creating our sort of mini healthcare fintech in terms of our prepayment product. We're seeking $800,000 US as a safe to really advance and capture more users, spread our network, activate more service access points, and onboard more healthcare professionals. We expect to have completed 400,000 patient encounters within the next 24 months if we get this funding. We would also be looking for medical equipment lease partnerships, as well as real estate partners to expand our reach. We have a very huge focus on impact, and our impact areas, obviously the SDG 3, but beyond that, we're also looking at the SDG 8, because Africa currently has 3% of the global health workforce to deal with 25% of the global disease burden and 11% of the world's population. And if we cannot keep our health workers back here, we'll probably just struggle to execute anything in healthcare. So we believe in improving economic opportunities for doctors and other healthcare workers, and it's a very core part of our mission. We want to grow fast, and that's why we need partners and investors to come with us. We're en route to getting our 5,000 users from that market union partnership this November. And we want to be able to rapidly ramp up to 200,000 users ASAP. Our route to achieving this is quite straightforward. A lot of it lies on getting the funding to drive this traction. We also want to, experiment a bit more with a service unit partner program. We believe that it's possible with good traction to, invite investors or private individuals to put ultrasound scans in different locations and earn passive income, for example, just like the same way you could put your car on Uber. Those are the sort of things that we want to be able to work on our journey to improving healthcare in Nigeria, and growing across Africa as a wider growth. We believe that there's an opportunity to reverse medical tourism. We believe there's an opportunity to concentrate the impact, that money that we're losing, and put that back and put it into infrastructure here, and start to attract, patients from other continents, from other countries in Africa to come to Nigeria for treatment. Thank you.